David, what led you to link conditions such as wildfires and smoke plumes to suicide?
There's a starting point, which is to say maybe mental health is affected in part because there's a physiological connection between the air pollution and your brain cells, and that deteriorates mental functioning and mental health. That's one kind of channel here. There's another, which is that air pollution has been linked to reductions in productivity. So if you look at kind of economic outcomes, you see people are more likely to miss days of work. They're less productive. Some of my own prior research looking at wildfires and the labor market has found that there are reductions in earnings in years where there are kind of more exposure to wildfire-driven air pollution. And, if you're missing days of work, less productive at work, that can also take a mental toll. So I would think of that as more of an indirect, it's a real impact of air pollution, but it's coming through a different channel. And there's a third reason why air pollution could affect mental health. And I think this is particularly true with very bad air pollution days, is often there are public health advisories focused on physical health that might encourage people who are in vulnerable physical health to stay indoors, to avoid physical activity. I mean, one of the reasons people engage in physical activity and go outdoors is for physical health, but it's also for mental health. It's good to get outside and get around. And if you're staying indoors one day, that might be fine. But if you kind of are encouraged to do so, or you're doing so multiple days in a row, that could take a toll. So there's a lot of reasons why there could be a connection between air pollution and mental health.
What were the goals of the study?
So one of the things we wanted to do in our study was to provide what we thought might be a cleaner test of the cause and effect relationship between air pollution and mental health by looking at spikes in air pollution that come from sources that are very far away from where people live. So the increases or decreases in air pollution on a given day are kind of random, at least random with respect to what's happening locally. And that's where we started to look at wildfires.
Can you explain the findings and trends for us?
Suicide rates have been on the rise for the past few decades, quite alarming. And there's a big urban and rural gap. Rural areas tend to have higher rates of suicide. Across the United States, the difference between rural and urban areas, suicide rates are about 30% higher in the rural areas. And that gap has been growing. We don't resolve kind of why those gaps are there, but that is an important starting point, is to just recognize that there are differences in urban and rural areas to begin with in mental health outcomes. And so what our study is doing is it's looking at one particular factor that may cause additional stress to people's mental health. And what we see is that the place where those effects really show up are in the places that are already disproportionately affected by mental health challenges, the rural areas. And we do breakdowns by different demographic groups, age and sex and education level. And when we look in the rural areas, we see that high air pollution days are associated with increases in suicide rates for many of those groups, not all of them, but many of those groups, especially white men of working age with less than a college education. When we look in urban areas, we do not see any evidence of a relationship between air pollution increases and suicide rates among any of these demographic groups.
What are some of the implications of the findings, and what do they look like in practice?
Suicides are relatively rare, but they're it's a very kind of tragic and costly outcome. But often the people, who are dying from suicide are physically healthy and potentially have many, years of life left. So in fact, when the CDC ranks causes of death by which causes are most prevalent, one way they do this is thinking not just how many people die from a certain disease, but how many years of life were lost. So if somebody, people who are dying from heart disease are often in their 60s or 70s or 80s, where the number of remaining years might be projected to be quite low. If they hadn't died from that, they would have potentially died from something else in the next couple of years. but suicides disproportionately impact young people.
What are the major takeaways and conclusions you drew from the study?
This is not the case that air pollution explains why there are suicides in the United States. Air pollution has been mostly on the decline over the past decades, while suicide rates have been increasing. So it's certainly not the case that that the air pollution is explaining all of the trends that we see and all of the gaps, but it's simply a contributing factor. And I think from the perspective of, I think about, there's lots of talk about climate change and even with wildfires, maybe on the rise. But by and large, when you look at air quality in the United States over the past decades, it's been largely a huge success story, huge declines in air pollution, improvements in air quality. There's some question right now about, have we kind of hit the bottom, and are things maybe trending back the wrong direction, in particular because wildfires are increasing? I think that's probably true, and that's something to be thinking carefully about. But overall, I think of our paper as more about, we document that there is this relationship. It's an important link. It just speaks to the benefit, one more of the benefits of improving air quality.
Thanks for your insight and talking to us, David. If you're having thoughts of suicide, call or text 988 to reach the 988 Suicide and Crisis Lifeline. I'm Cole Longcore.